Welcome back to Autism Live. We love this new segment that we've got that's called Ask an Autism Expert. Joining us via a lot of different mechanical, technological things is Gabriel Meyer. And Gabe, we're so excited to have you on the show for the first time. Tell us a little bit about what your role is at the Center for Autism and Related Disorders.
Okay. Well, I'm excited to be on the show, Shannon. I currently am clinical lead manager for now a number of different centers. Previously, I worked at our Santa Clarita Center in California, and now one of the roles that I've taken on is, because our family moved to Wisconsin, I'm supporting offices in some of our high-growth regions in Virginia, Maryland, Louisiana, where maybe we don't have that clinical lead support in those offices, and we want to make sure that the supervisors there are getting the support that they need, that the families are getting the clinical quality oversight that they need, and just kind of troubleshooting any other issues that come up, working with the operations team and those that are there on the ground in those states.
What a wonderful, wonderful thing to do. So, Gabe, we have some questions that some of our listeners and viewers wrote in, and I'm going to ask you the first one. It's how can I know, this is such a great question, how can I know when I should start potty training my son? He is 3 and nonverbal.
Yeah, there's a number of things that you need to consider at this point. Obviously, being 3 years old, the mom is kind of right to start looking towards potty training. The problem is that sometimes we want to make sure that the child has all the prerequisites necessary for potty training to begin. One of the big ones is going to be, can this individual or this child withhold their urine and their bowel movements for long enough? And so what you would need to do is you kind of need to make sure that you're tracking how often you're having to change the child, and usually you're looking for, at least, a couple of hours they need to be able to withhold. The other big factor here is that this child is nonverbal, which isn't necessarily a barrier to this child being successful with beginning the potty training process. The issue here would be, does the child have any sort of communicative skills? If they're on a PEG system or an augmentative communication system, then we might be able to get them to learn some of the indicative procedures that they need to follow. Maybe saying they need to go potty, or pressing a button on their iPad that indicates that they need to go. One of the areas you could start with this is just getting them to identify wet versus dry. It could be really helpful, so that way they can discriminate between those two things. But ultimately there's just a few of those prerequisites that we need to try, and then if your child meets that criteria, and even the communication part of it doesn't necessarily even need to happen. If they're withholding long enough, we can really start bringing them to the bathroom on an interval, and getting them to at least try to capture that moment where they are going to the bathroom while they're on the potty. But again, there'd just be a couple of things we'd want to evaluate for your child first.
One of my favorite things in talking to autism experts, in the autism community and among parents, there is this great fear that what if we aren't able to potty train our child, and we all have these nightmares about one of the first things that was said to me as a parent, once my son was diagnosed, and somebody was trying to make me feel better, and they were saying to me, oh, I have a friend and her child has autism and he's doing great. And I was like, really? Tell me about him. What's he like? Oh, well, he's 15. He's not potty trained yet. And I had nightmares about that, right? I was just like, oh. And I think a lot of autism parents have this great, great fear. But I love hearing experts talk about it, because you guys are kind of amazing in your attitude towards it, that you really have cracked the code on potty training, that when it's done properly, and you guys all love the Fox and Azarin method because you know that it works, that really you can have great success with potty training. And I have yet to hear of a single child that they were not able to potty train. Some take longer than others, but that pretty much everybody across the board, I don't want to say everybody because if there's a medical issue that can make it harder, but pretty much everybody gets potty trained, and it's not this big loop-de-loop. So I appreciate you giving us some of those precursors to know when it's time, but I hope that everybody takes a deep breath and realizes that this is very, 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 very doable for kiddos.
Absolutely.
And I loved your assurance. You were like, well, you know, and we can do that. I just love that attitude.